Assalamualaikum warahmatullahi wabarakatuh, and hi everyone. My name is Farah Dayana binti Muhammad Hairul and my metric number is 2024649886, and I am presenting a contemporary issue in talent acquisitions for HRM 552. And today I will be discussing the digital skills gap in the Malaysian healthcare sector. Malaysia is facing a critical digital skills gap in its healthcare sector, largely due to the absence of formal digital health education in medical and nursing curricula. While healthcare systems globally are embracing telemedicine, artificial intelligence (AI), and electronic health records (EHR), Malaysia healthcare workforce remains underprepared to use these tools effectively and confidently. Now we go, why is it critical now in 2025? Digital health adoption is accelerating due to global health trends and national policies. For example, Malaysia's 2023 Health White Paper. There is an increasing reliance on digital platforms for chronic disease management, mental health support, and remote patient monitoring. Employers are demanding digitally fluent health professionals, but the talent pipeline is unprepared. Without immediate educational reform, Malaysia risks a delay in digital health implementations, widening health disparities, and also losing healthcare talent to countries with better training and tech infrastructure. The first impact is healthcare workers are underprepared for digital tools. As for example, a study published in the Lancet Regional Health Western Pacific found that none of Malaysia's 24 medical schools have a standardized digital health curriculum, and only 12.5% offer any exposure to digital health. As a result, medical graduates enter the workforce without training in essential digital tools like electronic health record (EHR), telemedicine, and mobile health system. As for the second impact, increased stress and reduced job satisfaction when adapting to digital systems without proper training. As for example, in a 2022 study conducted among public hospital nurses in Malaysia, as a Pacific Journal of Health Management, researchers found that nurses reported frustration and job stress while using digital charting systems due to lack of proper training and technical support. Many rely on trial and error learning, which lead to documentation errors and increased workload, ultimately affecting morale and job satisfaction. The first one, slower digital adoption due to lack of internal capability. As for example, a 2023 market analysis by the US Department of Commerce noted that Malaysia's public hospitals and clinics struggle to adopt electronic medical records (EMR) systems due to a lack of skilled internal staff to implement, maintain, and troubleshoot them. The adoption rate of EMR remains uneven, especially outside of major cities, despite EMR being a national priority. Next, the second impact on the organization's reliance on external consultants, including operational costs. As for example, according to an article in Healthcare Asia magazine 2022, several Malaysian private hospitals outsource digital transformation projects, including EHR implementations and cybersecurity, to foreign vendors due to a shortage of local expertise. This outsourcing increased project costs up by up 30% compared to in-house executions in digitally advanced health systems like Singapore's. Next, we move on to the impact on the government. The first one, national initiative call for digital reform but lack implementation at the education level. As for example, the Health White Paper 2023 introduced by the Malaysian Ministry of Health, however, the policy does not include specific mandates or timelines for integrating digital health education into medical or nursing curricula. The disconnect between strategic goals and the training reform creates a gap where graduates are unprepared to meet the policy's expectations. Workforce readiness doesn't match digital health policies. As for example, a 2024 article in the Lancet Regional Health Western Pacific reveals that Malaysia's workforce is ill-equipped to meet digital health goals, with only a minority of local institutions exposing students to digital health, mostly basic health IT. There is no systematic training for digital literacy, telehealth competencies, or AI use in clinical practice. Now we can go to the impact on society. The first one, inequitable access to quality healthcare due to underutilized or inefficient digital services. For example, A 2023 study published in JMIR Medical Informatics found that in rural and undeveloped parts of Malaysia, digital health services like telemedicine were poorly adopted not because of lack of technology, but due to the lack of trained professionals to operate them effectively. As a result, rural communities continued to facing limited access to care, while urban areas benefit more from digital innovations. The second impact on the society: passion dissatisfaction and lack of trust in digital services. As for example, a 2022 survey conducted by the Malaysian Communications and Multimedia Commission's MCMC revealed that while awareness of digital health platforms grew during COVID-19, many patients expressed concerns about the reliability, security, and human touch of these services. Respondents cited poor user experience and difficulty navigating systems, often due to untrained healthcare providers, as major reason for dissatisfactions. Malaysia risks falling behind regional peers in healthcare innovations. Malaysia, while making strides with initiatives like the Health White Paper 2023, still lacks the necessary digital skills training among its workforce to match the pace of regional peers. This slow innovations and adoption of new healthcare technologies. The second consequences: talent outflow to countries offering better digital training and infrastructure. As for example, a 2023 article in The Star reported that increasing numbers of Malaysian healthcare professionals are migrating to countries like Singapore, Australia, and the UK, attracted by better pay, career growth, and access to advanced digital health training. Many cited frustrations with Malaysia's slow education reform and limited use of digital tools. Introduce mandatory digital health modules in medical and nursing curriculum. What it means is by all medical, nursing, and allied health programs in universities and colleges should include digital health as a compulsory module, not just as an elective or part of general IT literacy. Why it is needed? Most Malaysian medical schools currently do not offer digital health as a structured course. Moreover, graduates enter the workforce unprepared for digital tools now widely used in hospitals. And lastly, early exposure helps build confidence, competence, and readiness for evolving healthcare system. The University of Queensland in Australia integrates digital health training in its undergraduate curriculum for medical and nursing, including hands-on sessions with telehealth system and EHR platform. Next, I will go to the second point for short-term solution. Upskill current staff via CPD, which is Continuous Professional Development Program focused on digital tools. What it means is by implement ongoing, structured training programs for current healthcare workers, doctors, nurses, pharmacists, which focusing on practical digital skills. Why it is needed? The first one, many existing staff receive no formal digital health training. And then the second one, resistance to digital transformation often comes from a lack of confidence or familiarity. And then the last one, upskilling improves service quality, staff retention, and system adoption success. As for example, the UK's NHS Digital Academies offer CPD-based short courses for healthcare workers to upskill in digital tools, AI, and leadership in health tech innovation. The first point is revise Malaysian Qualification Agency (MQA) and MMC requirements to include digital competencies. What it means is by the Malaysian Qualification Agency (MQA) and the Malaysian Medical Council (MMC) should formally update their accreditations and competency standards to include digital health as a core area in all healthcare-related programs, such as medicine, nursing, pharmacy, etc. Example, the General Medical Council in UK integrated digital capabilities into its outcomes for graduates in 2021, ensuring all new doctors are trained to handle digital systems, data, and remote care. Now we go for the second solutions. Provide incentive for medical schools adopting digital health frameworks. What it means is by the government or Ministry of Higher Education (MOHE) would offer financial infrastructural or reputational incentive to public and private medical institutions that integrate digital health modules into their core program. As for example, in Australia, the government supported the creation of Australian Digital Health Agency and partnered with the university to provide funding and curriculum support for integrating digital health training into medical and nursing programs. The first point is establish a national digital health education task force. For example, Ministry of Health (MOH), Malaysian Qualification Agency (MQA), Malaysian Medical Council (MMC). So the purpose is to align education, regulation, and healthcare delivery with national digital health goals. Other than that, to oversee curriculums, reforms, workforce planning, and certification standards. As for example, United Kingdom. General Medical Council (GMC) reformed in 2021. The UK's GMC updated its outcomes for graduates framework to formally include digital literacy, data ethics, AI awareness, and use of digital technologies as core competencies for all medical graduates. How this can relate to Malaysia? Malaysia's MMC and MQA can adopt similar reforms to maintain digital competencies, ensuring medical graduates are ready for a tech-driven healthcare environment. Develop digital health master's programs. What it involves a structured postgraduate degrees, master's or diploma designed specifically for doctors, nurses, healthcare manager, and some more. Why does this program needed? Currently, Malaysia has no such program despite rapid digitalizations. Second one, it builds a pipeline of specialized professionals ready to lead change. And another one, meet rising demands for experts in hospital IT departments, health startups, and policy making. As for example, University of Edinburgh MSc in Digital Health. This program offers advanced training in health data science, mHealth, telemedicine, and digital transformation leadership tailored for healthcare professionals and IT specialists. Graduates lead digital health initiatives globally. How does it relate to Malaysia? Malaysia can create a similar postgraduate pathway to fill its talent gap and develop leaders who understand both healthcare and technology. In summary, the digital skills gap in Malaysian healthcare is a critical issue that directly impacts talent acquisitions, workforce productivity, and passion gap. Without urgent reform in education and training, we risk falling behind in digital healthcare innovations. Thank you for watching. I hope this presentation has shed light on the importance of integrating digital skills in healthcare talent development. Thank you for watching.